Hello, you guys.
Hi, Megan.
Hey,
So, what are we getting into today?
Megan, you're so good.
Thank you. I like you in front of the camera.
Oh, thank you.
Okay, you just won her over.
You guys stop it. Stop it.
I like you too, DH. You're not that bad.
So we're going to talk about the aging phase today.
We are.
Yeah.
I
So-
love this one, and I think it's the perfect
Facelift.
time to tackle this subject.
Okay. Yeah, this is a really, really great topic. So we're going to talk a little bit about what are some of the criteria that would make someone think about having a facelift.
Mm-hmm.
And
Yeah, so while we're kind of
talk about
on
some
that
solutions.
topic, can we talk a little bit about who would actually be a good candidate for a facelift since
Yeah.
we're getting into it?
Okay, I love that. Let's jump right into it. Go ahead, DH.
So normally, so facelift accomplishes from the eyes to the collarbone. It's not for the brow. This is a brow lift if we're doing something up here.
Yep.
And normally, the parts of the face that concern a person the most would be jowls,
Yep.
right? When
Jowls,
someone starts to
the
see
turkey
jowling,
neck.
and then looseness in their throat area. So those are the two main things. Also, there may be some marionette lines, these lines that go from the corner of the mouth down, and then nasolabial folds can be improved a little bit with a facelift too.
Mhm.
So yeah, so if someone feels like they're getting sort of just a face that's just kind of sliding off of their skull, then that's a person who really would not get sufficient benefit from doing something less than a facelift.
The average age for a facelift is still 57.
57. It's been like that for
But-
decades. It hasn't really changed.
But there's a wide range of ages that people do get facelifts, though. We have people getting facelifts in their mid to late 30s to in their 80s.
Yeah, even 90s.
Yeah, depending on the person's goals and their concerns and their desires. So it really just depends on the person itself.
Right. And the reason so the average age remains 57. It hasn't changed in decades, but what has changed is facelifts have become very customizable. There are facelifts that are very excellent for someone who's very young and doesn't need a lot, and there are facelifts that can do some very significant heavy lifting for a person who's into
Needs
their
a little
80s.
bit more, yeah.
Yeah, and the other thing that makes facelifts an option for someone who's older is that facelifts can be done very safely today. You don't need to be asleep for a facelift. You can do them comfortably awake, which opens up a lot of doors for people.
It does.
So yeah, generally when someone comes in looking for a facelift, that's the thing that I would say is jowling. Is the one
Jowls,
thing that
usually, yep.
they just can't stand.
Yep,
when they have
jowls
to
and jowls in the neck area. Even if somebody calls in or comes in for a consultation and they really haven't thought about their cheeks maybe sagging or they're getting some jowls, and they're more so just focused on the neck, that is still in our office. We consider it a facelift because of where the incision starts, and we'll kind of go over that with you as well.
So what happens with the aging face why the jowls develop is that early in our lives, those lovely apples of the cheeks sit kind of high, and then as we get older, there's a little resorption of the bone and the skeleton, and the muscles decline a little bit, and those fat pads just kind of slide off the face, and they end up kind of pulling everything down this way. So there's just not the same support underneath, and the skin also becomes less elastic, and that's kind of what leads to the problems that people don't like. And really, when that falls this way, that leads to those what are called marionette lines, where this kind of like falls off to the side, and these are labial folds. That's what people don't like. And then of course we lose elasticity in our throat too, and that leads to this turkey gobbler stuff or this really looseness that people don't like. And facelift addresses that because on a facelift, you're basically going to be pulling almost horizontally down in the neck area, and then with other various vectors of obliqueness coming through the face, and then almost vertically here at the sideburn area to really get that beautiful natural look. And the facelift really has to look natural, or there's no point.
Exactly.
Let's tell them a
And they do look very natural these
Let's
days,
tell them a little bit about the incision of a facelift.
Right, okay. So the design of a facelift incision is to make them so that they're not noticeable. So That leaves us putting them in, so it goes behind the tragus. This is the little thing called the tragus, almost all the time. Now, there may be a man, for instance, where there's a significant crease in front of the tragus, especially if you don't want to be pulling sideburn into their tragus, then you can do it in front of that. But normally, always, you're going to come around the tragus, and then you're going to pick up the little crease around the earlobe and follow that crease all the way back into the thickest part of the ear, and then transition into the hairline and come down that way. And it also is going to go up this way and then come back down, and then I do what's called a double beveled incision around this little tuft of brow, because you don't want, or sideburn, because you don't want to raise that, because that doesn't look, so this has to stay where it's at, and then these incisions really need to fall into creases or behind creases so that you don't see them.
Yep, and it heals so beautifully and so naturally.
His facelifts are amazing. Seriously, all of them that I've seen, I'm like, oh my gosh.
I know, I love it.
Yeah.
And we do what's called a high smash facelift, which is
There's also a
capital
deep plane
S,
facelift, but most of ours are high smash.
capital M, capital A, capital S, high smash facelift,
Yeah,
and
right.
that's the unstretchable layer.
Smash layer is.
Yep. That he really uses to do the heavy lifting of the facelift.
Yeah, so we certainly don't want to just free up the skin and then retack that skin down, because then it's going to look windswept. So we really have to do the lifting is in that smash layer. The smash layer is over top the glands and muscles, but underneath the skin, and that gets lifted up a little ways out, and then that's where the pull happens underneath the skin, and it goes almost vertical here, and then various vectors this way, and then almost horizontally over here, so that that's all done with the skin loose, and then the skin can get draped almost like you're doing a pie crust. Just kind of lay it back down and then cut in, and then just kind of tailor that extra skin, and then just attach it back there very nicely. We use a microscope for a lot of that, so that really lays down beautifully. Then we also will laser the skin in our office, deal with reds and browns and sun damage and just the fine lines and wrinkles. So that's also part of a really good facelift, is to use energy systems to improve the skin as well as remove the excess skin. And then what's the other thing that we can do, Wanda, to add volume back?
Yes, and that was something else that we were going to go over, is something that you can really do with facelift, and we think it's icing on the cake with facelifts, is doing a fat transfer to the face with a facelift.
100%.
And the reason being is, he had mentioned it earlier too, is as we age, we lose so much volume in our face. So a great way to kind of restore that volume back into the face is doing a fat transfer with a facelift. And you can do, if we were doing a fat transfer with a facelift, then we normally will take that fat from the tummy area. If you have like a little pooch that's just annoying, we can kind of sculpt from that area, and then we purify it and put that fat right back in.
And I feel like it really just helps age them backwards and
It does.
puts the cherry on top with the facelift.
It really does, because whenever you put fat back into anywhere, wherever we're transferring, whether that be the face, the hands, the breast, or the butt, it has to bring a new blood supply in order for that fat to survive.
Fat globules in that transfer.
So what it does to the skin from the inside out is beautiful.
Yeah.
But we do that a lot with our facelift.
Yeah.
So living fat transfer, at first it's harvested like liposculpting, right? So it harvests teeny tiny little 30 micron globules of living fat, and then we purify it so that it's just the fat, everything else is removed. And then it doesn't just get squirted in, you actually have to thread it in. So we really want to recover those orbital rims here, where the bone would be right here, so that is nice and smooth like it appears in youth. And then also we get hollows in the temples, so we want to kind of re-volumize that area. Above the eye oftentimes gets hollowed out. And then also these folds around the nose, if you can put a little fat in there, kind of restore jawline, even put some fat in the lips. All those out into the cheeks, restore the apples
love
of the
it in
cheeks.
the apples of the cheeks.
It just looks phenomenal.
Yeah.
to do
It really
fat
does.
transfer with a facelift.
Now, I'm sure you guys get this question a lot whenever you guys have facelift consultations, but I'm sure a lot of people want to know, how long does a facelift actually last when you get one?
Well, that's a great question. I'll let you take this one, DH.
Well, so a facelift really lasts forever. It's not gonna, sort of wear out or expire, and then, but we do continue to age. So I always liken it to like an escalator, where you can take somebody who's down on the escalator and move them up a whole, story. But the escalator continues to go down. But still, by the time you're like, say, halfway down the escalator, you're still better off 10 years or 15 years from now than you would have been had you not had that work done.
Most definitely.
Yep.
And in fact, having a facelift supporting those tissues will allow a person to age slower. It just kind of supports that up there in most cases so that they age slower.
But if a person does come in here and they're in their, let's say, late 30s, early 40s, then they may get something like a mini facelift or extended mini facelift, but then maybe even opt into
Most
getting
likely.
another facelift,
10 or 15 years later.
Yeah, or 20 years later.
Right. Yeah, so I mean, it's all has to do with what a person's demands of their life are. So facelifts can do a lot of things. They can give you momentum in your career. They can give you momentum with your relationship search, if you will, or they can just give you more confidence for your daily life. Or if you want to do it for your significant other, so that they're more happy and proud of being with you, and so you're more confident that way. And that's what makes it a
Absolutely.
Really big
The
difference.
more confident you are, the better I feel like we treat people around us.
But it all comes back to it has to look natural, because when we, if we're going for it to increase our feeling of confidence, then it really depends on us, looking confident. And when someone is not feeling that, or when someone doesn't look natural, then it looks like they're trying too hard, and that's not a confident look.
Yeah.
So it really needs to look natural, and that's. I don't think I'm alone in this, but all good facelift surgeons are going to really look to make it look natural.
Something else. What is something else that we do a lot of time in our facelifts to really address the neck?
Right.
area?
So oftentimes too, because the throat can be really one of the most difficult and persistent areas of aging when people have a lot of laxity, is it will open up just in a little crease underneath the throat here and bring this loose tissue together, sort of corset it together down the front. Also remove some of that fat that's deeper there, so you can really get a nice angulation and really restore that down the center underneath the skin, and that's really looks awesome.
So just a teeny tiny incision right under the chin. After it's completely healed, we laser it several times at post-ops. It's really unnoticeable. It's beautiful.
And some people also will need some liposculpting.
Liposculpting.
To sculpt
Yep.
out some extra, fullness in that area.
Yeah.
Fat.
Yep.
That's also part of it.
Another thing that I really like that we are able to add on with facelifts, if it's eligible for somebody, if somebody needs it, I guess is a correct word, is a lip lift.
Oh, right. Yeah.
I love doing lip
Oh
lifts
my
with
goodness,
facelift.
yes.
If somebody needs one, and I'll kind
That's
of
the upper lip,
Yeah.
right? So it's a kind of like looks kind of like a bullhorn, if you will.
incision.
So it's like
Yeah.
comes like right in the crease underneath the nose, the top part of the incision, and then comes down almost like a bullhorn as it comes below here, and then that just lifts this lip. Especially if someone's getting older and they can't see their upper teeth anymore because that lip is so long.
Yeah, as we age, our lip tends to get longer and it kind of curls in and down. And then when you go to smile, you barely have any show of your teeth.
This is kind of a newer procedure with facelift, and it really looks awesome.
It does. It
And the
looks so
difference
good.
it
It's
makes
so
is
natural,
insane.
so
Right.
beautiful.
So let's talk about some other things that people do with facelifts, right? So
Yeah.
if they have a lot of redundancy here, we could do
We
a
do
little,
lower lid
little-
skin pinch.
pinch out some of that extra skin and just kind of sew that up. That looks amazing.
Mhm.
That also heals with really, essentially, and I mean really no noticeable scar, because it's right under the rim of the eyelashes. Anything inside the orbit that's closed even reasonably well and is not going to have any scar that you can
And
detect.
then you can do your upper eyelids with the facelift as well. Upper blepharoplasty.
blepharoplasty. If there's hooding of
Done
that upper
same
lip.
way.
And many people will like to have a brow lift at the same time too. And we do our brow lifts. We could talk. That's a talk for another day. But put it inside the hairline again, and that really restores a really youthful appearance when you can get that brow to come up a little bit like that.
Oh,
That
definitely.
really looks really great.
Oh my gosh, you look 20
I
years
know, right?
Oh,
But it does
God.
sometimes. It does.
She's so
always
mean.
messing with me. But yeah, that can look really good too.
It does look really
And
good.
then the facelift, basically, if you want to see what a facelift looks like on you, then you're really going to kind of pull, not this way and not this way, but sort of like that. Kind of
Yes.
spread the fingers as you go. So these are kind of going up, and then these are kind
Yeah,
of
whenever I'm on the phone with anybody or they come in for a consultation and they're immediately doing this to their face, There's not a non-surgical option that is going to get you any type of lift like that. So you're definitely looking into some kind of facelift, whether that be mini facelift, extended mini facelift, or a full facelift.
But let's say somebody doesn't want a facelift, but they want to improve it.
Okay.
So there are threads. You can do threads that can go in here and do some pull. They last 18 months or so. But that's a nice sort of a minimally invasive. Yes, that's a little bit of surgery, but it's a it's a minimally invasive procedure that can give some benefit. Lasering the face. We've had kind
huge
of laser
improvement in that,
on our face in the last week. I'm a little bit looks kind of like sunburn.
I'm recovering
right now.
from opus.
But that's something that can thicken and tighten the skin. That really
beautiful.
restores the
And
youthful
that's
look.
something else I think you mentioned earlier, but whenever somebody does a facelift or a brow lift in our office, we always package together laser treatments as well, no charge,
Right.
Because we really want to
Part
take
of the package.
Yeah, we really want to resurface the skin. Somebody might have age spots or sun spots, skin. They need skin tightening, fine lines and wrinkles. So it really just resurfaces that skin. So that is all included in a facelift package.
So that kind of leads me into my next question. So obviously when somebody gets a facelift done, you want to protect that investment, obviously.
Yep.
What are some things that can help them with that?
Okay, great question. Go ahead.
We'll both answer this one. So skincare, right?
Definitely
so
is
you want to have an
huge.
enormous, a really good skincare regimen that that you continue with for the rest of your life, actually, and should include some kind of a retinol. Of course, you want to be from there on much more careful about sun,
Yep.
right? Especially noon sun, so you don't destroy the dermis any more than the elasticity of your skin than you already have, and get irregularities of the pigment of your skin. So you want to be careful about sun. If you're a smoker, so I would say stop smoking.
Anyway, you're
If you can.
I mean, you're not wrong.
Right.
You're not wrong.
Right. So I mean, all of us have habits that we can do better with, and that's one. If you can
Mine
do
would
better.
be energy drinks. What's yours actually?
Honestly, I don't know if he has a bad habit.
I have some.
I don't know.
I have certainly in my life. I had. In fact,
had
I
to.
used tobacco
I had
for
to.
a few, a little bit of my life. Actually, I don't know.
Oh my gosh.
But yeah, so and my dad had lung cancer, so I'm really like all in about.
Oh my gosh,
Stopping
you just made my
smoking.
heart drop.
He
I know,
is.
right? So
Yeah.
that's something. Because you know what, tobacco is such a ball and chain. It does not reap rewards at all.
My husband needs to watch this.
It's so
video.
toxic.
I'm gonna send it to him.
And it's so toxic that if you feel like you're ready to quit, quit. Because it really does age your skin. And it's harder to do a facelift on someone who's a smoker because they just don't
With
heal
the
as well.
healing, yeah.
The healing is really impacted by that.
Yeah.
Absolutely.
So we really want you to not smoke for at least a couple of weeks before and at least a week afterwards.
Yeah.
But then another way to really protect your investment, because it is an investment, you are investing in yourself. I always encourage people to at least get a hard resurfacing laser done, even if you can every 6 months, but even once a year is a great option as well.
Yeah, even if you're only now in your 30s, or that's a good time to start, taking your skin to the gym regularly.
Yes,
So
I mean, I'm hoping with just taking care of my skin the way that I do with medical grade skincare and lasers and getting some toxins here and there, that I don't hopefully need a facelift when I age, but if I do, so be it. But if you are getting a facelift, the way to protect that investment, again, skincare, and then just getting some resurfacing lasers that are going to produce that collagen growth at least once a year.
Yeah. And then, so if you're interested in wanting to find out more about this, there's information on our website.
Yep.
And
But
certainly,
the best way to find out more information, I can give you a detailed proposal that gets sent home with you that evening or that day, would be to call the office, make a consultation with one of the girls at the front desk. They'll find the perfect time and date for you.
at all.
And then you'll come in, hi baby.
And we do Zoom conferences too, if you want to do
Got
it.
a friend in the
by Zoom.
office.
But yes,
do
you'll
that.
have that consultation with myself and Dr. Hartman. Again, we'll go over start to finish what that day would look like for somebody. depending on what that person's goals and concerns are.
So let's talk for a minute while we're on that. What is recovery like, Wanda? I mean,
Recovery on a facelift,
probably much quicker than most people expect.
They will definitely have pretty significant swelling, possibly even pretty significant bruising that day, the day that they leave. That second day, third day, it's
Third day still some
pretty
swelling,
significant.
for sure.
But by that fourth day, they really start turning a corner on their bruising and their swelling.
Certainly, yeah. You start to really look like you've seen something.
But
good
I
on that fourth
always
day.
tell clients, if they're getting a facelift done, wear your hair a certain way. That way you can hide the incisions, headbands, hats, scarves, whatever. But give yourself at least a week to 10 days where you're not really going to be out in public or really be around a lot of people. But still, again, hiding those incisions, because your incisions are going to be kind of pinkish and red. Sorry, my little one is here keeping us company as we're wrapping up.
At least he's happy.
And then so most people, I would say, I'd say about 80% of people are going to return to the routine by about a week out. Now, that's not to say that it's not a bad idea to maybe have some glasses that you could wear.
Absolutely.
Or wear your hair a little bit differently for a little while. But most people are moving back. 80% of people are going to be moving back into their jobs or the routine by a week. And actually, you can start to move back into running errands and things by the fourth day. No problem.
Yeah, and then I've
Most
even had
definitely.
a lot of our facelift clients are working from home the next day. As far as pain after, they may be sore, definitely sore around the ears,
And
very
maybe on the side of the neck.
very common. But as far as pain and
It's not that much.
yeah, it's
Tylenol
really
and Motrin is enough.
yeah, absolutely. And they're working from home if they can, if they have that opportunity to. But definitely a week to 10 days, give yourself that. But
And
still
everybody's
hiding
different.
those
Everybody's
incisions.
different. Some
Yes,
people
absolutely.
will have experienced more prolonged discomfort than others.
Yep.
We've had people go back to showing houses the next day or going
Those
for a
are those
cruise the next
people,
day.
that
Some
they
people
don't
do.
mind if they ask, what did you have done? Like, why is your
Yeah.
face look like
You count on at least a week now. I would say
Yes,
that would be
absolutely,
the
or
ideal.
even longer.
Yeah.
All right.
Okay.
How did we
Fun.
do, Megan?
You did great. I mean, you answered all my questions.
Okay.
So, yeah.
Honestly, guys, when this video is posted, if you guys have more questions, drop them in the comments. That way, we're all able to tackle those
Love that.
questions.
Mhm.
Yep.
Yeah,
All
thanks
right.
for
Thank you
joining
so
Thank you
much.
guys. I'll
Thanks.
see you tomorrow.
Bye.